Hi, welcome back. In this lecture we're going to look at some of the do's and don'ts for members of staff, for professionals and for family members working with or supporting a young person who may be at risk of self-harm. So first of all we'll look at some of the do's. Okay. Do make time for the young person. Sit down and spend time with them, helping, supporting them, getting to understand them even better than you already do. Okay. Listen to what is being said by the young person and check on a frequent basis that you have understood the meaning. Okay. So listen very closely. Develop those listening skills even more so than they already where they're at the moment. Okay. On a regular basis, check out the worries and concerns that the young person has. Okay. Help them to offload those worries and concerns. Encourage them to talk about those worries and concerns. Help them to develop coping strategies. Help them to problem solve with those worries and concerns. And if you can help solve some of those worries and concerns as well, also you do that. But the ideal is where we help the young person, work with them to solve those worries and concerns themselves. So then they're learning to manage themselves more effectively in the future, rather than us as helping professionals quickly jumping in and solving the problems for them. Okay. Whatever the young person tells you, always respond with concern, with interest and with compassion, rather than anxiety or distaste. And that's easier said than done sometimes, especially where the young person tells you the in-depth details of what led up to their self-harm and exactly how they self-harmed and what they did and what the result of that was. Okay? So remember, concern and compassion rather than distaste or anxiety or shock. Okay? Remember confidentiality, always very important to working with any client group. Okay? So remember to keep accurate records of all the work that you do with the young person and keep their information confidential. Only share it with other professionals who have a right and a need to know about it. Okay. Be aware of your limitations, the limitations within your professional role. You're not Superman, you're not Wonder Woman. There is only so much that you can do within your role. Okay. And as a human being. So remind yourself actually that you have limitations. Okay. We can't be a saviour for young people. We really can't. We can't be there 24 hours a day for them and solve all of their worries and concerns for them all of the time. Okay. So be aware of your limitations. In any intervention that you have with a young person, you will always have at the end of that intervention some follow-up plans about when you're going to meet next, what will be on the agenda next, what kind of things are you going to do during the week ahead, what kind of things will the young person do during this week ahead until you get to meet again. Okay, so discuss those follow-up plans, come to an agreement on them and make a record of them. Liaise with all the other professionals and family members, for example, that are involved with this young person, and do that in line with guidelines on confidentiality and consent. Okay, so very important to have the young person's consent when sharing information with other family members, for example. Okay, access supervision for yourself. Very important for professionals working in the helping and support sectors to make sure that you set aside time, ideally once a week for at least an hour, with your line manager, or if your organisation is lucky enough to have a therapist or psychologist to provide clinical supervision. Really do make use of that, because working with any client groups in mental health, for example, can be very stressful and difficult at times, and working with young people who self-harm can also be very stressful. So you need to take better care of yourself. Make sure that you're taking care of your needs in that way as well. Okay, it's no good you neglecting your own needs and then you get burnt out, you feel stressed, anxious and worried, for example. Okay. Those are the do's. Here are some of the don'ts. Don't make assumptions about people who self-harm. Try not to listen to the stereotypes and the negative press about people who self-harm. Okay? There's always a complex story behind every case of self-harm. So remember not to make assumptions. Don't ignore self-harm, of course, no matter how superficial it appears to you. Even if it appears to be some very light scratches on the arm, for example, it's something to pay attention to, something to follow up, something to make a record of, and to talk to the young person about. Okay? There's always a reason behind every incident of self-harm. It doesn't just happen. Okay? And no matter how superficial the injury looks, it's always important. Something else is going on there. Don't assume someone else is helping the young person unless you actually know that a person is helping that young person. Okay? So check out the support that that young person is having and make sure that they are obtaining adequate care and support. Okay? Never make agreements that you can't keep. So don't promise the young person that you're going to solve all these 15 problems that they've written a list of, because in most cases you won't be able to solve every single problem that a young person brings to you. Okay? Reassure them that you're there for them to help and support them, and that you'll do your very best in helping them with whatever they need help with. But don't make promises that you can't keep. Okay? Can you think of any other do's and don'ts to add to that list? That'd be really helpful. Okay? Thank you.